Hi guys, my name is Dr. Kaylee. I'm with Navigate Health and Wellness. Today you're going to see a Webster Adjustment, which is a special technique for when you're pregnant. So this is Shauna. Shauna, you are 24 weeks pregnant, right?
Correct.
And baby number 3. So when we first start with Webster, we're always focusing on the pelvis. So do you have a little bit of pinching on that right side still?
Yes.
Yeah, I felt that too. So when we bend the knees, we're checking for sacrum. So sacrum is this triangle bone down here. And we use an instrument-based technique in our office, or we also use drop pieces in the table. So no cracking, nothing scary. Right, Shauna?
Right.
Not scary.
Not scary at all.
People always call and say, are you going to crack me when I'm pregnant? And I was like, no. So when we release sacrum, that was nice and even there. We're going to work this muscle here. It's called your piriformis. So bone, muscle, ligament, right? That's the pattern that we use. So because we release your sacrum on the right side, we're going to work on your sacrotuberous ligament on the left. So give me a little cough. Perfect. So that ligament goes from your sacrum to your sit bone, and that is a stabilizer for sacrum. And so after we adjust the sacrum and after we release that soft tissue that's around it, we are going to use that ligament to help stabilize and again keep that sacrum in the perfect alignment. So what we're using now is this ligament hold as a way for us to get all this extra tension from the mid-back out as well. The mid-back tends to compensate a lot in pregnancy and have a lot of changes here because of the extra weight of the belly hanging forward. So this is a way for us not to overstimulate the nervous system. Great. All right, so that's half a Webster. After that, we're going to check your upper neck. So it's very important for us to always check the brainstem. So go ahead and turn your head to the right and to the left. Does that feel okay down there in your hips?
Yeah.
Back in the middle? Okay, so you've got a right short leg, which just means that we're going to be checking you on the right side. Good. Now go ahead and turn your head to the right again. And to the left. And back in the middle. So we're going to do bone, muscle, ligament on the opposite side. So
okay.
Bone is going to be your pubic bone. So that little piece of cartilage in there gets separated when those bones start to separate, right? So it starts to pull. So we're going to use the instrument for my thumb better. Okay, go ahead and bring your arms up. And now we're going to check the psoas. So when we do that arm check, it lets us know what side of the body we have the most restriction on. It's one big fascial plane, right? So this muscle that we're going to stretch comes through your pelvis, and we're going to pin it and stretch it. Let's recheck it. We're going to basically stretch until the arms are even. These muscles get really tight. Closer, a little more. All right, so the psoas is even. Did you see your hands there? They were nice and symmetrical. But your belly is a little tight, so we're feeling for those round ligaments. So the round ligaments are part ligament, part muscle, so they get little adhesions in them sometimes. So when we keep those ligaments nice and loose, and we keep the pelvis balanced, baby tends to take on a good position. 82% of the time, babies will turn in the right position when moms are getting adjusted, which is really cool. All right, go ahead and bend your knees. You go on your back for a little bit. We'll do a little traction. And you're all set. Go ahead and lift that up. And come on back.